A very common demand from the trans women is the hourglass shape of their bodies. And in this video, I will be telling you how we can achieve this feminization of the body from a male torso to a very feminine looking torso with the BBL surgery or the hourglass shaping surgery. When we talk about body feminization, what are the essential characteristics of the torso feminization? Number one on my list would definitely be breast implants. And if you have enough fat, even fat transfer in multiple stages could do the trick for you. But when we are talking about breast feminization, of course, it has to be added volume. A typical condition is when a trans woman has lost a lot of weight. So in that case, they may also need a lift procedure along with the augmentation. So it would definitely be breast implants or breast fat grafting if you have enough fat. So when we talk about fat transfer, I would definitely want to cover in this video the fat transfer to the hips or the butts. And altogether, we can call it a BBL surgery. But in the trans women, I like to do an accentuated BBL surgery. So in hourglass shape, we talk about removal of fat from the tummy area, that is the abdomen, the flank area, that is the sides, along with an accentuated curve for the waist area. And this happens when we take out the fat from the prone position or from the back. So lower back and the mid section of the torso from the back when we take out, this gives you a very accentuated hourglass shape. Of course, we can do the upper back also and a little bit of this part of the arm if the condition so desires. So essentially what we're doing is reducing the width of the upper body, accentuating the mid-torso with fat removal from this area so that you can get that waist shaping. The lower back fat can be removed, and all of this that we remove from the abdomen, from the sides, from the waist, from the upper back, lower back, all of it can be put in the butts. And that is how we get an augmented hip so that you can look wider in your hips to match with your proportion from the shoulders, and you can also accentuate your butt curvature posteriorly. So you will get a feminine butt. So we are removing all the volume excess and we are adding it to the butts. So this is essentially what is called an hourglass BBL in the trans woman. Another interesting procedure that is actually becoming popular slowly is the rib remodeling for waist shaping. So that requires small cuts in your waist area through which we remodel the last rib, that is the 12th rib, so we can achieve that waist slimming in a more accentuated manner. So these are the surgeries that are essentially required. But yes, I'll tell you with my experience that sometimes it can happen that your skin on the lower part of the butt is too tight, and the first session will actually release that tighter skin and make that skin more pliable and more lax so that next time we can put more fat in the butt. So I do this in stages. So a couple of stages around 3 months or 4 months apart will do the job for you. But again, if your body can take in enough fat, then we can achieve a great result even in one session. So if you have questions regarding hourglass shaping for yourself, please write in the comment box and my team will be ready to help you. Thank you for watching.